Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important side effects of thioridazine. Thioridazine is actually a low potency first generation. It is low potency first generation antipsychotics. Okay, this thioridazine is actually associated with pigmentary retinopathy. It is associated with pigmentary retinopathy. Then it rarely causes prolongation of QTC interval. It rarely causes prolongation of QTC interval. Thank you for watching.
Thank you and thank you for watching.